Thank you all for joining us today. For this great occasion, our public health vending machine, the unveiling of it. Before we begin, I'd like to take a moment to recognize some guests that are with us today. So, first and foremost, the mayor of the city of Laredo, the Honorable Dr. Victor D. Trevino, with his lovely wife, Ms. Rosa Marquez de Trevino. Laredo Public Health Director, Dr. Richard Chamberlain. And Dr. Julie Bazan, representing the Area Health and Education Center. Today's event represents a pivotal step forward in our commitment in enhancing health and well-being throughout the city. This vending machine goes beyond convenience. It serves a vital resource equipped with items like Narcan, hygiene essentials, and information on key services here at the Health Department and throughout the city. Without further ado, I would like to introduce our first speaker, and the Honorable City of Laredo Mayor, Dr. Victor D. Trevino.
Thank you. Good morning, everyone. Dr. Victor Trevino. Glad to be here at my second home, as we call it. As we're living challenging times here when it comes to public health, mental health, addiction, poverty, there are tools that we can utilize in our community to mitigate the impact of deaths and drug overdoses. People experiencing an opioid overdose need naloxone, commonly known by the brand name of Narcan. Narcan can reverse the effects of an overdose if it's given to a person timely. The person will still need medical attention after administration of Narcan. So these Narcan vending machines are effective tools. We have seen throughout several studies throughout the country, Narcan and vending machines contribute to about 15% reduction in overdose deaths in the first year of operations. In Nevada and in Cincinnati, research found that 24/7 access to Narcan supplies was associated with fewer deaths and slower spread of certain diseases like HIV and other diseases. One of the realities that we understand is that people using these vending machines may not have an opioid addiction, but they know a loved one or a person that they care for who is in need of this, and they need to be prepared for any emergency situation. Depending on the doses, most people do not die from opioid-related injections right away. It takes between 30 minutes and 3 hours. So the problem that most people around the individual do not recognize the signs of overdose. So this gives people an opportunity to administer a life-saving antidote medication right away. So as mayor and as a doctor, I will continue to advocate for more funding and more of these measures for our community. Thank you very much.
Thank you, Mayor, for the words and the continued support. Our next speaker is our Public Health Director, Dr. Richard Chamberlain.
Good morning, everyone. It's wonderful to see everybody here. We appreciate everybody enjoying the cooler weather as we are out here not sweating, but maybe we might have a little bit of the sniffles from the cooler weather, but we absolutely enjoy the cool down. I wanted to start off by talking about what's in our vision, what's in our mission at Public Health, and this is a public health. I don't want to say that it's a buzzword, but it's very common in public health, which is achieving health equity. And what is health equity? Health equity is when all individuals, regardless of their socioeconomic, geographic, demographic backgrounds, are able to reach their fullest potential. And us at Public Health, we are always marching towards health equity within our system. And this new machine, and I don't want to call it a vending machine because we are not vending anything to any one of the persons who will be getting access to the different products that are available to them. It can be our health and hygiene dispenser, our community wellness hub, our self-service health station, our care access kiosk, our public health care dispenser. This is exactly what this machine will be doing to help elevate those persons who might not have access to naloxone, Narcan, as our mayor just mentioned right now, but also to influenza tests, PCR, or antigen COVID tests, pregnancy tests, hygiene kits. All this is going to be available within these machines. And I say machines because we are unveiling our first one here at Laredo Public Health, but we already have plans to expand to 2 additional sites, and we're very hopeful in the coming days and months that we expand into at least every district of the city of Laredo to make sure that ointments for preventing infections on new scrapes or cuts is available to persons in the community, and ensuring that we are bridging those gaps, especially for our under and uninsured populations. So we are very excited about this initiative. It's not new. I know our colleagues and our friends at Pillar have started out with their vending or their access dispensers in the past, concentrating on harm reduction, which we have elements of harm reduction within our machines here, but we are taking it a step further and putting public health into these dispensers, making sure that we are reaching as many persons as possible. So expanding access to health and hygiene dispensers promotes equitable health care and public health by providing essential items to underserved populations. These machines address barriers like cost, stigma, limited clinic hours, and ensuring resources, as mentioned, like COVID tests, condoms, pregnancy kits, and I can even share that in our dispensing machines, we will be having free access to laboratory analysis that gives you your chemistry, which many persons in the community don't get access to their blood chemistry, and that is extremely important for them to take the steps in order for them to have a better health outcome. So increased access fosters prevention, early detection, and healthy communities, and you will see us continue to champion that every day forward. Thank you so much for being here with us.
Thank you, Dr. Chamberlain. Our final speaker for today is Ms. Erica Martinez, the Assistant Director for Laredo Public Health.
Good morning, everyone. Final speaker. I'm the one between you and seeing the great dispenser that we have unveiling today. Thank you all for joining us. I just wanted to echo some of the words that we heard from our previous speakers, our Honorable Mayor. He talks about public health being his second home. Public health is for all. So just as Dr. Trevino, our Honorable Mayor, and his beautiful wife feel so comfortable coming here, visiting us, helping us, talking about our services, we hope that everybody in the community feels welcomed. You know, we've been very intentional this last year. I've heard a lot of comments about how the energy in our campus feels different, feels more alive, and we keep being very intentional on how we are welcoming to our community and how we continue to provide services that are needed for our dear Laredo. Dr. Chamberlain speaks about health equity and access, and this is definitely something that we champion with Laredo Public Health. We want to make sure that if people feel the need to come forward to obtain these items, that they are able to do so free of cost, and at a discretion with confidentiality. I will share that this is not the final location of our dispenser, our public health dispenser. It will be downstairs between our public primary care clinic and our dental clinic, very close to our access to our elevator, but it does offer that discretion that if someone needs to obtain an item, they have that little pocket of confidentiality. So without further ado, we'll go ahead and welcome the Honorable Mayor to do the unveiling of our public health dispenser.